Hello and welcome to Health Professional Radio. I'm Patrick Reyes, and on today's segment, we are joined by Dr. Frank Taus. He's an ophthalmologist from the Eye and Laser Center, Gold Coast, who specializes in laser vision correction, cataract surgery, and refractive surgery. Welcome to the show, Frank.
Hello, nice to meet you.
And yourself. Now, go ahead and tell the listeners at home more about yourself and what it is that you do.
I'm a glaucoma, cataract, and refractive surgeon with a strong interest in new technologies and means of correcting both short-sightedness, long-sightedness, glaucoma, especially the new variant of so-called MIGS, which stands for minimally invasive glaucoma surgery. Glaucoma is one of the bigger damages of human vision, and we have got a number of new means now of correcting the problem of raised intraocular pressure, which is actually the problem which creates the loss of vision in human beings.
Before we go ahead and talk about MIGS, what was your motivation or your inspiration into becoming an ophthalmologist?
Gee, it's one of those things that you wonder what you're going to do. I knew I was going to be a doctor long ago, and one of the interesting features about ophthalmology is the fine motor dexterity of ophthalmic surgery, which is one of the fortunate areas of my expertise, and I enjoy the microsurgical challenges that ophthalmology offers in that surgical sphere. So I guess that's what drew me into the field, and have been a very busy microsurgeon since.
And you are a specialist in laser vision correction, and just earlier today I learned about ASLA because I only knew about LASIK. What is the difference between LASIK and ASLA?
ASLA is basically the first generation of laser vision correction that came out, where we actually reshape the cornea by working on the corneal surface. It's a very, very good correction, but it takes a little bit longer for the patient to get better. The comparison is LASIK, which was the second generation, where we actually lift a flap of corneal tissue and do the correction in the stromal bed and then put the flap back down. That way around, patients are better in 1 to 2 days. Now we've got the third generation laser correction, which is actually called SMILE. And SMILE stands for small incision lenticule extraction, where we actually take the corrective piece of tissue out of the middle of the cornea through a hole and take that tissue out. So it's another one of these minimally invasive procedures. As I was speaking about MIGS for glaucoma, which is minimally invasive glaucoma surgery, we've got minimally invasive refractive surgery now as well, which is where SMILE is going. And it produces a wonderful correction that's better the next day.
All right, so let's go ahead and talk about MIGS, or minimally invasive glaucoma surgery. What exactly are the procedures or treatments for that?
Well, as I alluded to with respect to the refractive surgery component, we've got this tiny little hole where we take out these bigger pieces of tissue to make the correction, and anything that is minimally invasive is good. Now, in glaucoma surgery, in the past, we've used external procedures to make, simplistically speaking, a hole in the eye, which we cover with the eye's own tissue to retard flow and discharge the flow of fluid underneath the conjunctiva, which is the white of the eye. Now, the reason that we need to do that is that the natural flow pathways inside the eye are blocked. If we access the blocked mechanisms from inside the eye, where the fluid of the eye is actually approaching in the normal flow sense, if we can fenestrate this area called the trabecular meshwork, where the actual obstruction is, we actually facilitate outflow of aqueous humor from the eye and lower pressure. And that is indeed what these little things called iStents. Now, there are a couple of different MIGS procedures, and they have different devices, but just for the purpose of the discussion, I'll restrict the discussion to iStent. So this little device, which is the smallest prosthesis used in the human body, it's about 0.3 of a millimeter by 0.4 of a millimeter, and it is held on the end of a type of injector, which we can pass across from one side of the eye to the other to access this trabecular meshwork. And it's called iStent inject. So it actually injects the little prosthesis into the trabecular meshwork, thereby making a little hole in the blocked trabecular meshwork. As it passes through, it reaches another structure which is called Schlemm's canal and stents and holds that open. That's what stenting is. It holds open a structure, whether it's a blood vessel or a canal. So this device fenestrates trabecular meshwork and stents Schlemm's canal, which makes the aqueous humor, which has been blocked by the damaged trabecular meshwork and glaucoma, flow through the hole into the stented Schlemm's canal and within access of the so-called collector channels, where the fluid flows out of the eye into the normal body's blood circulation again. So that's what an iStent is.
If anyone wanted to get these iStents, are there any precautions that people should know of?
Well, the good news about these iStents is that they are very, very safe. They basically have no complications and work probably 90% of the time. Unfortunately, they don't work for everybody, because if those little things that are called just now called the collector channels are blocked, it's not bypassing that. So we need a different kind of mixed procedure if we need to bypass the collector channels. But 90% of the time, by bypassing the blocked trabecular meshwork and stenting Schlemm's canal, we allow the fluid to run out faster, thereby lowering the pressure, thereby lowering the damage at the optic nerve, which causes the damage in glaucoma.
Mm. Now, are there any specific misconceptions of glaucoma or MIGS that you would like to clear up?
Well, it's certainly what is correct is the fact that it is minimally invasive, and it honestly does have virtually no side effect. The only negative really is that there's this 10% chance that it might not work for that person. So, if it is a misconception that it's going to work for everybody, that's just not true. But 90% is a pretty good number that someone can hitch their hopes on when they go for this procedure.
Right. And now, before we go ahead and end the segment there, what's a message you would like to give our audience as to being part of Health Professional Radio today?
Oh, if a person has glaucoma, or if they have a family member with glaucoma, or if they are very short-sighted, or if they are very long-sighted, all those people fit into a glaucoma risk category and should have their eyes checked by their local optometrist so that they can be referred through for further care, one of which of those care pathways may be iStenting.
All right. Well, thank you for joining us today, Frank.
You're most welcome. Thanks very much for asking.
Now, you've been listening to Health Professional Radio. Again, I'm your host, Patrick Reyes, and we've been in conversation with Dr. Frank Howes as we talked about a bit of laser vision correction and glaucoma and also MIGS. If you've missed our conversation, or if you'd like to listen to this interview again, transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.